The final day of the consideration of the 2022 budget estimates started with the Minister of Health, Dr. Frank Anthony, defending the massive allocations made to his ministry. Now, on their questions from opposition parliamentarians, the minister had to explain why significant sums of money were going to the various subsectors under the Ministry of Health. And in answering those questions, the minister detailed the number of provisions that were made. Of course, what was of particular importance was the $16 million that has gone towards the construction of 6 new hospitals across Guyana. In addition to that, Dr. Anthony announced that significant sums of money, more than $800 million, has gone towards subsidizing the cost for local and foreign health care for patients here in Guyana. This, of course, is building on what was announced by the Finance Minister, Dr. Ashni Singh, during his budget presentation in January. Then, the Finance Minister had announced that the government would provide up to $600,000 annually to the more than 300 patients in Guyana who need life-saving dialysis treatment. The Health Minister, Dr. Anthony, also detailed other areas which monies will be going.
We also made an allocation of $931 million, and include this is going to NAPS, National AIDS Program Secretariat. And in this particular program, we are switching out some of the older ARVs that we were using. And we have a new algorithm that we'll be using now for our patients. And this involves newer drugs, and they're a little bit more costly. We have also allocated $776 million for laboratories, the National Public Health Reference Lab.
He noted that large sums of money would be going towards the COVID-19 response since we are still in the COVID-19 pandemic. Of the sums allocated for COVID-19 support, $60 million alone would be going towards transportation, that is, getting vaccines out of Region 4 and to the various regions. In addition to that, more than $200 million has been allocated and approved for healthcare workers or for workers, contracted employees, to assist at vaccination sites in getting the vaccination program ahead. The minister also announced that the head office of the Health Ministry, which has been under construction for some time, is expected to be completed this year. These and other programs all fell under the more than $57 million allocation for the health sector. Reporting for the newsroom from the Arthur Chung Conference Center, I am Vishani Raghavir.